Hello, I'm Mary Colbert. Welcome to Dr. Colbert's Divine Health Podcast. We are excited to be here. And Don?
Oh, I'm excited, Mary, because that's been one of our goals, is to take every major disease and show you how to reverse it naturally, as well as spiritually and nutritionally. And if need be, we can even use medications. So
we are excited about doing this as a new approach with us. So we may be repeating some subjects because we are recording live in Life Today International. James Roberson's his studio. Yeah. And Bruce Jacobson is our good friend, and he's the producer. And he said, Don, Mary, come here. We'll do it here. And we just so appreciate them and their team that's helping us today get set up. But the main reason we're doing this is for you. We know it's expensive to see Dr. Colbert. We know for many of you it's nearly impossible. You can't travel to him. You can't afford to pay. We get it. That's why we prayed and we asked the Lord, what can we do? We want to reach the people. We want to touch you. We want to give you this information that God has downloaded to him through the years. So that's our mission. Our mission is to bring everything Don has ever treated, what he does, what to take, where to get it, where you can find it. And he's doing all this for you. I hope you appreciate what we're doing because this is free. We're giving it out there for free. So when you become a partner with Divine Health in any of our products, when you partner with us in purchasing our products, you are partnering with us to be able to do this, for him to take the time to research and study and write. All that costs money, but you can't do it without partners and support. So we don't ask for people to send us money, but we do appreciate you partnering with our products.
By going to our website.
That's right, to divinehealth.com or drcolbert.com, and you can see all the products that we have there. Okay, so this is our first. I like what Andrea said. It's an evergreen. Yes. This is an evergreen mission. It's going to forever keep giving and giving and giving. This is going to go around the world. This is going to go in countries all over the world. Right. I know this in every language, so I'm excited because we really are passionate about bringing you the most current, up-to-date information on how you and your family can walk in divine health.
But let me kind of give them an overview, because what we're doing is we're going to make it a series of these YouTube videos or Rumble or podcasts. And what we're doing, for example, today we're talking about how to reverse type 2 diabetes or pre-diabetes. I have seen this for decades and decades, and we have reversed thousands of patients with type 2 diabetes. The key is we got to catch it in time, and we do it a combination of methods. Number one, the diet. The key diet to reverse diabetes is the healthy keto diet. I've written books on this. One of my books is the book Beyond Keto that I just wrote a couple of years ago. It is the healthy keto diet. And by the way, 95% of keto diets are unhealthy. You say, what makes this keto diet healthy? Because I put all the good in it, the good healthy fats, as well as the veggies that you need, because most keto diets are woefully low in veggies, as well as the fiber and the fish oil that we need. But then not just the diet, we have the nutraceuticals and nutritional products that help support healthy blood sugar levels, as well as the fiber. And we're going to talk about these later in the show, as well as the spiritual components, because yes, there is a spiritual component to diabetes. Those people have not crucified their flesh daily, not once a lifetime, daily, and laid the foods on the altar that they should lay on the altar. And then, again, sow the right seed to reap the right harvest. Most people are sowing seed for every disease. And you're going to see how type 2 diabetes literally invites every disease into your body. So you've got to get the spiritual roots to it. But first, we just have to talk about the magnitude of the problem. You see, type 2 diabetes is increasing dramatically because it's following the obesity epidemic. As the waistline increases, one's risk of type 2 diabetes and pre-diabetes increase. In fact, if your waist measurement as a man is 40 inches or greater and waistline as a woman is 35 inches or greater, you already have most likely insulin resistance and pre-diabetes. So you're a ripe candidate for it.
Now, Don, this is really important for people to understand this. Insulin resistance.
Right.
Explain that real quick to the people because they need to understand this is the key right here.
Diabetes doesn't just occur. Diabetes starts with insulin resistance, which means our cells become resistant to the action of insulin. Insulin is a hormone produced by the beta cells of the pancreas, and it works like a key, and it binds to insulin receptors on the outside of cells. And when it binds to that receptor, the cell opens up for sugar to enter in, and sugar is able to enter in the cell. But what happens as we eat more and more sugars, carbs, and starches for a prolonged period of time, our cells start to become insulin resistant. In other words, the pancreas has to produce more insulin in order to bind to the receptor to open the cell so that the sugar enters into the cell. We become resistant to the effects of insulin.
So the way I see it, it's like a rusty key.
Right.
You're getting rusty.
Exactly. It's like the key. Insulin is like a key that opens up the lock so that the sugar can enter the cell. But what has happened, mainly because of our obesity, we are developing a diabetes epidemic. For example, right now in this country, according to the CDC, 28.7 million people are diabetic, type 2 diabetic or type 1 diabetic. That's a lot of people. But according to the CDC, 8.5 million who have diabetes do not even know that they are diabetic. Then together, that's about 37.3 million with diabetes. They don't, and 8.5 million don't even know they have it.
How can you not know you have it?
Because, again, they've not noticed that, again, diabetes is many times silent until you start to get increased urination, blurry vision, sores that don't heal. But if they don't get that increased urination, increased thirst, they don't know they're diabetic. They just think, hey, they're fine.
Wow.
But then, listen to this. 96 million U.S. adults are pre-diabetic. Together, 96 million, or 1 out of 3 adults here in America are pre-diabetic. They're headed to diabetes. They're insulin resistant, which means their insulin's not working properly. And they most likely are obese also. So together, that's 133.3 million American adults, not even children,
guys, this
are
is
diabetic
scary.
or pre-diabetic.
Now, do you think this is true across the world?
Well, yes, because many of the same restaurants in the U.S. are in many different developing countries. Now, again, if countries are eating the diet that is out, when they were primitive people like in Africa, they're still eating food from the land. A lot of veggies.
I bet it's even higher in Mexico and
with
states.
all the processed corn and flour and things like that and chips they're eating. It's just amazing among the American Indians and Eskimos have a much higher incidence of diabetes. But listen to this. Type 2 diabetes accounts for 90 to 95% of all diagnosed cases of diabetes. In other words, it's not type 1. Type 1 is where you don't produce enough insulin. Type 2 diabetes is where you are insulin resistant. You got plenty of insulin, it's just not working, and your body's producing more and more. So we're going to get to the root of this and explain how.
Now, Don, I know that from your patients that have come in to see you, I have heard of thousands of people applying what you're getting ready to educate people about and what they do that now are no longer type 2 diabetes. I'm telling you, if you'll follow what this man says and you do it diligently, you can reverse your type 2 diabetes. I believe that. Now,
but Mary, first they got to understand, first of all, like Deuteronomy 28, the 28th chapter of Deuteronomy talks about all these blessings will come upon you if you heed the word of God and follow the word of God. And then also in Deuteronomy 28, it talks about all the curses that will come on you if you do not heed the word, the commandments of the Lord. Well, there are curses that come upon us if we have diabetes, type 2, type 1, or pre-diabetes. So I've got to talk about the curses because this is in Scripture. We have Galatians chapter 6, verses 7 and 8. It says, be not deceived. Be not deceived. God is not mocked. Whatsoever seed you sow, that shall you also reap. He who sows to the flesh will of the flesh reap corruption, but he who sows to the Spirit will of the Spirit reap life and life everlasting.
I like what you say to people, especially when we go into churches and places and we speak. You catch a cold, you catch the flu, but you develop disease.
Right.
And that comes from consistently making wrong choices.
Correct. But
And that's what's going on here.
the key complications of diabetes are the main diseases we're seeing every day in medicine. Number one, vascular disease. Long-term elevated blood sugar increases the risk of plaque in your arteries throughout your body. Plaque in your coronary arteries will lead to heart disease and heart attacks. Plaque in your peripheral arteries will lead to peripheral vascular disease and leg pain when you walk. We call it claudication. So diabetes simply causes accelerated plaque formation in your arteries. In other words, it ages your arteries. Your arteries start to clog up with plaque.
Wow.
In the brain, it causes plaque buildup in the arteries to your brain, which can lead to a stroke, especially when combined with high blood pressure. Those two go hand in hand. Diabetes and high blood pressure go hand in hand, but the main reason why diabetics die is from heart disease. That's the main reason,
Wow.
cardiovascular disease.
Wow.
Also, most diabetics, many diabetics, not most, but many will have what we call silent heart attacks. With a heart attack, so many people develop chest pain, shortness of breath, but a squeezing pain, like an elephant. They describe it to me like an elephant sitting on my chest. Well, interesting that with diabetes, the diabetes damages the nerves so that many diabetics don't even feel chest pain, or they have what we call silent heart attacks. So that when they go to their doctor and they do an EKG, they say, oh, you've had an old heart attack because there's a scar on the heart and it's picked up by the EKG with Q waves.
That's unreal.
So that's just one little complication right there. Now, another is peripheral vascular disease, like I said, or claudication, because we develop plaque in the arteries furthest from the heart. So patients will start to have pain in their calves when they walk. This is called claudication or peripheral vascular disease. And it'll get worse and worse because there's poor circulation. The arteries in the calves and legs are starting to form plaque buildup. And so again, your arteries are being diseased or aging rapidly. Another is eye disease. Diabetes actually affects the eyes because it affects the small little arterioles, the tiny little blood vessels, and will cause hemorrhages in those blood vessels that can cause blindness, or it can lead to retinal detachments. And diabetes is one of the leading causes of blindness in this country. So when you are choosing to have type 2 diabetes or pre-diabetes, you're choosing to have visual problems. And your eyes are supposed to last you 90 to 100 years. You are aging your eyes when you have diabetes or pre-diabetes. They're getting older before their time. And when that happens, literally, eventually, so many people lose their vision just from diabetes. So it's that Galatians chapter 6, verse 7, be not deceived, God's not mocked. Whatsoever seed you sow, that will you reap. When you choose to have type 2 diabetes and pre-diabetes, you're aging your eyes. You're losing your vision. Also, kidney disease, and this is huge. I have seen so many patients, so many with kidney disease. And the reason is because when you have high sugar, it damages the nephrons. It ages your kidneys, and your kidneys eventually don't function properly. And what happens is we start to develop kidney disease, elevated creatinine, elevated BUN. So that's why it's so important to get this under control before your kidney disease is advanced. I have found that so many businesses are starting out, which are dialysis centers, because we have such a huge abundance of diabetics that have developed kidney disease, and now they have to go and get dialysis 3 days a week for 3 hours, and that's one of the complications. See?
That is so scary.
Other complications besides kidney disease are diabetic neuropathy. We talked about how neuropathy affects the heart and causes silent heart attacks. We start to get diabetic neuropathy in the feet, in the fingertips, in the feet and toes. And so what happens, you develop numbness and tingling and burning pains. And this can eventually get worse and worse so that you develop diabetic ulcers because you don't feel it. So people are going outside, stepping on things, getting infections. And then because of the poor circulation and infection, they have to have toes amputated, feet amputated, legs amputated. I cannot tell you how many patients have had amputations because of diabetes, type 2 diabetes and type 1 diabetes. So it's critically important. The other is dental disease. It causes periodontal disease. It causes gum disease. People lose their teeth. They have to have dentures. It causes ED. It literally affects the arteries in your penis. It literally chokes off the arteries so you don't have blood flow, and it causes ED, a major cause of ED, as well as increased risk of COVID and infections. Remember, COVID, one of the major causes of COVID pneumonia and death was diabetes.
I just want people to know that I know you're hearing a lot of like, oh my, but I want you to stick with us. Stay with us, because Don's going to give you some solid answers. You can still reverse it.
Absolutely.
And that is what's important. Now, we have got a couple of products that will assist you in your program. One is whatever you eat. This book is critical.
This is the Reversing Type 2 Diabetes Diet and Pre-Diabetes Diet Beyond Keto.
You need to get a hold of this book, Beyond Keto, wherever
this is
you
the healthy
get it,
keto diet.
From our website, Amazon, whatever. I don't care where you get it. You need to get it and read this, because this is the beginning, what you've got to start to do to reverse this diabetes epidemic that is going on around the world. The other thing is it'll help you with your appetite and help you in so many other ways is our amazing Fiber Zone. We have it in a 2-month supply or a 30-day supply. We went to a big supply because so many people said, Mary, I feel like I'm going through it and I'm running out of it too soon.
That's
so
a 2-month supply.
Make it bigger, because this, once you taste how good this is going to be a part of your regular life.
Mary, this lowers the glycemic index of any food that you eat, which means it brings the sugar down. It binds it in the gut. It also satisfies your appetite and prevents those sugar cravings, especially at night.
Now, that's what I have done. And I have done this because Don always says, fiber covers a multitude of sins.
Dietary sins.
That's right, dietary sins. And I am the biggest dietary sinner.
She is. So she sinned this morning.
He made this for me. Yes,
she
I
ate
did.
Pancakes.
No, I ate a waffle.
A
half of a waffle with some berries and sugar-free syrup. So, I mean, I did pretty good. But he was sitting there looking at that carb, and it was just... It just ruined his own
But she did have her
breakfast.
fiber, which is good. I didn't say a word, though. I didn't say a word.
Didn't say a word. No, you just thought, look, just gave me the look. Okay, Carb Assist.
Mary, I developed this product to help lower your blood sugar. It literally supports normal blood sugar. It contains the alpha lipoic acid, 600 milligrams a day, that helps prevent neuropathy. But what it does, it supports healthy blood sugar levels, but it also supports healthy nerve function. It also has the high amount of chromium, which is so important for supporting healthy blood sugar, 800 micrograms a day, as well as berberine, which also supports healthy blood sugar, as well as cinnamon in the form of Ceylon cinnamon, as well as vanadyl sulfate. So it has the key nutraceuticals that support healthy blood sugar levels. It's my favorite product, twice a day.
And if you go on Instagram and you stay tuned and watch us, you're going to get an additional discount for tuning in and watching this. So be sure, if you have Instagram, to go in there and do that. Okay, Don, let's get back to...
hold on. We're talking about, again, if you sow bad seed, you reap a bad harvest. And so the other two diseases that people are unknowingly sowing seed to form are, number one, wrinkles. Women, when you choose to have
my attention.
High blood sugar, diabetes or pre-diabetes, it causes accelerated aging. It causes wrinkles, sagging skin. It causes your skin to age, but not just your skin. Every single organ in your body will age when you're pre-diabetic or diabetic. It's critically important to get your blood sugar checked, but also your hemoglobin A1C. If your hemoglobin A1C is 5.7 up to 6.4, you are pre-diabetic and knocking on the door for diabetes.
Don, that's an important point.
It's real
right
important. And
there.
I check it on every patient.
Numbers.
I check it on every patient I see. But if your hemoglobin A1C is 6.5 or greater, you are diabetic, most likely type 2 diabetic, and you'd better get this thing under, or else you are headed for all of these curses. The last curse I got to talk about is increased risk of Alzheimer's. I just wrote a book called The Healthy Brain Zone, which we are seeing an epidemic of Alzheimer's, which is termed type 3 diabetes. It's diabetes of the brain or insulin resistance of the brain, but we are seeing such an increase in Alzheimer's, which will be triple the amount in the next 30 years, because the Alzheimer's epidemic is simply following the obesity and the diabetes epidemic. That's what's going on. So that's what's happening. But we can reverse and prevent every one of these diseases if we catch them soon enough. We're going to be talking about the answers, because now the answer is real simple. And again, we've talked about the problem, but It says in Galatians 5:24, they that are Christ, or if you're a Christian, they have crucified their flesh with their passions and lusts. Unfortunately, so many Christians are lusting after garbage and sugars and starches and carbs, which is garbage, which are simply inviting the disease into your body. So we want to talk about the key diet, and I wrote books on this. I've written 2 big books on it, Beyond Keto and Dr. Colbert's Keto Zone Diet. And these simply teach us how to adhere to a healthy keto diet. Now you say, what's the difference in a healthy keto diet and an unhealthy keto diet? Well, first of all, a healthy keto diet contains healthy fats. What are healthy fats? I discussed this in detail in here, especially your olive oil, extra virgin or high polyphenol olive oil or oleocanthal olive oil, as well as avocado oil. It also should be cold pressed avocado oil, as well as your seeds and nuts and fish oil, and just a small amount of saturated fats. Saturated fats, of course, are butter, cheese, cream, coffee creamer, whipped cream, ice cream. All of those are high in saturated fats, as well as coconut oil, as well as fried foods and fatty meats like hamburgers, hot dogs, sausage, bacon, brisket, steaks. All of those are high saturated fats. So the keto diet is a low carb, that is the key, high healthy fat, about 70-75% of your diet as healthy fats, and a moderate protein, about 15 to 25% protein diet. What is so amazing about this program is when you have to understand the average American diet or standard American diet is a high carbohydrate, unhealthy fat diet. In other words, most of the people on the standard American diet consume about 50% of their calories as carbohydrates. And actually, the U.S. dietary guidelines recommend that we consume 45 to 65% of our calories as carbohydrates. You have just signed up for pre-diabetes and diabetes based on our own U.S. dietary guidelines. We have got to lower our carbs, sugars, and starches to minimal. I say 5 to 15% of our total calories should be carbohydrates or less, but especially for most around 5%. I personally take about 15% because I lost too much weight. So I shifted more to a Mediterranean keto type of diet now. But also, so we've got to get our healthy fats high. And the standard American diet has 50% of their calories are carbs. That's wrong. About 35% as fats, but most of those fats are inflammatory fats, saturated fats, too much polyunsaturated fats that are deep fried or trans fats, so unhealthy fats. And then we have about 15% protein. To make this shift, here's what's happening. We lower our carbs to about 20 grams a day. Now, 20 grams is like 1 to 2 slices of bread a day. And I just tell people, leave the bread off. That's high carb food. The whiter the bread, the sooner you're dead, because it causes, when you eat white bread without any fiber, you get literally you absorb a lot.
Spike,
you get a sugar spike. It converts to sugar, and you absorb a lot of sugar, and you have a high glycemic index and high glycemic load. And so you get a lot of insulin secreted. So what happens, you are becoming insulin resistant when you do. So again, what we want to do is put the right fuel mixture in. And here's what happens. When you put the right fuel mixture of the right amount of carbs, about 20 grams of carbs a day, up to 75 grams a day, and you want it 70% as healthy fats. So literally 2/3 of your diet is going to be healthy fats. So a lot of olive oil, or a lot of salad, or a lot of olive oil in your salads, and then you want about 15 to 25% as healthy protein. I go into detail on how to do this, but here's what happens. Your body makes a metabolic shift from burning sugar as your primary fuel, sugar, carbs, or starches as your primary fuel, to burning fat as your primary fuel. And then the key fat, the belly fat, is one of the first fats you start to burn. And so when you do this, you're making a metabolic shift from burning sugar to burning fat. Now, the best way to explain this is sugar is a dirty fuel. When our bodies burn sugar, here's what happens. Your bodies will produce ATP, but it's got to feed through the mitochondria, and in using sugar, your mitochondria produces more free radicals by using sugar as the fuel. But if you use fat as the fuel, you produce less free radicals. So what happens is you're preserving your mitochondria, so your energy, your producing more energy when you burn fat. It's similar to using a hybrid car. When you are burning gasoline, it's a dirty fuel. It produces exhaust. But when that hybrid car shifts over to electricity, that's a clean fuel. You're not having any exhaust. Similar to what we're doing with keto. When you eat sugars, carbs, and starches, you are going to literally be burning sugar. So what happens, your sugar goes up. When your sugar goes up, your insulin level goes up. When your insulin level goes up, your sugar goes down. So every 3 to 6 hours, when your sugar goes down, you get hypoglycemic and you crave sugars, carbs, and starches. So you get on this sugar cycle every 3 to 6 hours, and insulin causes your body to store more belly fat. The more higher your insulin goes, the more belly fat. So you're stuck in a vicious cycle and you can't break free. The key is the Beyond Keto diet. It teaches you how to break free. We show exactly how to do it. We do it by simply teaching you how to shop. And in my books, I teach you how to go to the store, how to empty your cupboards from the junk, the garbage, all the junk,
Don,
garbage
I think
food.
that's a really important point right there, because if you have it in your house, I know especially because people buy things for their kids to snack on and stuff, and so it becomes a little bit
and the
challenging.
kids get obese.
Yeah, and then the kids get obese. That's right.
And pre-diabetic.
But
and fatty
what
liver.
you're going to be doing is you're going to be teaching and training your children how to eat.
Sure.
So you do want to go through the cupboards and get rid of the stuff, the temptations in your fridge and all that. Just get rid of it. That way you just stock it with the things that you can snack on, like nuts.
Healthy nuts, that's what I eat at night. And at night, I'll have a heaping teaspoon or a tablespoon of my Fiber Zone with 4 to 8 ounces of cold water. When you have this literally fills you up. It helps to lower the glycemic index too, but you get that fullness feeling, then go to bed early. The later you stay up, the greater your risk of eating carbs, sugars, and starches and raising your insulin levels and program your body to store fat.
Now, one thing I have noticed, too, is when I eat more healthy fats, like avocado, putting olive oil in the soups that we eat or put it on my salad, I notice that when I do that more, my appetite goes down.
Exactly.
It really does.
And that's what I teach you how to do in my books, Beyond Keto and the Healthy Keto Zone. I'm literally teaching you at breakfast, like I'll have 2 scrambled eggs, I'll have a half an avocado, I'll have either gluten-free toast or keto toast with olive oil on top.
With the avocado oil.
Correct.
And just a teeny
bit
of butter for to add some flavor, and that's it.
And then for lunch,
you pour the olive.
Sure, I pour my olive oil on my toast. Sure,
instead of doing
it fills me up,
and he is satisfied.
Absolutely, it keeps your waist down. You're burning fat as fuel. And again, realize if you eat sugar, carbs, and starches, you're going to be burning sugar as your fuel. And about every 4 hours or so, 6 hours, you're going to be getting low blood sugar, increased appetite, more garbage, higher insulin spikes, more fat storage. It's a vicious cycle.
Now, Don has also written, a book on Keto Zone. He wrote a Keto Zone book, so he's not anti-keto.
Right.
This is a great book to do for like 3 or 4 months to get you going.
It's simple,
real simple, and to bring
everyone can do it. I have a week of menus for breakfast, lunch, and dinner, easy to follow.
This will bring I call it your flesh in control. Now, once you get there, you don't live there. You can't live on the keto diet. Not really. Not in this.
Well, you can.
time.
Yes, you can. Yes, you can.
It's really difficult.
It's not hard at all. I've got many cancer patients that have been living this for decades.
Yeah, that's
decades,
different.
Mary.
If you've got cancer and you're wanting to live, I mean, obviously you're going to sacrifice. But then
you feel so good on the keto diet, but this is a keto Mediterranean diet where we add more.
This is the one you can live on.
You can better. It's easier to live on this because you put in healthy carbs along with your real healthy fats.
And this is the one I really follow most of the time. Every now and then I stray a little bit, but I stay with this most of the time, and this is doable. This is doable. And if I do stray, what I do the Fiber Zone.
Yes, covers a multitude of dietary sins. And then the Carb Assist helps support healthy blood sugar levels. Really important. Carba says you can get these products on Divine Health at drcolbert.com.
Well, this is our first podcast. We're going to do 3 on these. You will need to stay tuned to all 3 because we're going to be covering more information on reversing diabetes. God bless you, and we pray that you walk in divine health.
Amen. God bless.